welcome back to the 2023 All Things Senior Expo here with the city of Scottsdale. We're at the gorgeous city's Center for the Performing Arts. Nicole Holtsclaw, I've got you joining us today.
Yeah, thank you.
Thanks for having us in. Sun Health at Home. Talk to us about Sun Health at Home. What do you guys do and what are we talking about downstairs?
Well, we're somewhat of an innovative product. So we are the first and we're the only continuing care at home program in the state of Arizona.
Okay.
We're one of about 32 programs that exist in the U.S. The majority of those are along the eastern seaboard, though. So we are the only one actually west of Tennessee, would be the next closest program to us.
Wow.
I don't count Honolulu. For those folks who live in Honolulu, great, gorgeous place to retire. But so is Arizona. And so being the first and being the only, we took the concept of a continuing care retirement community and really flipped us on its head by partnering what they are successful at by providing engagement and that life care promise for folks to have access to a level of care when they may need it, but then also adding in the best parts of long-term care insurance and partnering the two of those together to allow folks to have an option to age in place where the majority of folks want to stay and still have availability to resources. But really our overall mission is to help them age well at home and really keep them out of assisted living and memory care and skilled nursing by providing those services in the home and then also paying for it.
Well, that's great. So because we all want everybody, there's a lot of nods to everybody having this great dignified, life at home, and everybody wants it. For the most part, everybody wants to age in place. They want
Exactly.
They want to stay home in your Alamo. It's the reason you got your forever home and work your way to it.
Yeah.
The reality is it's pretty darn complex when you start getting into long-term care insurance, where it comes on. Honestly, for adult kiddos, we're not half the time we're not even paying attention to that stuff because it's not our time yet.
Exactly.
Until all of a sudden there's some issue where we have to start stepping into it. And insurance policies, half of us couldn't tell us what our regular insurance policies are on a car or anything else, let alone figure out where long-term care insurance, what activates it, what is an activation off of that, what events happen. So you guys, that's where the rubber meets the road. You have that capability to activate those and to help those get started.
It is, but we've also removed the barriers to utilize those policies. So traditionally for folks that have a policy or even have the capability to still take out a policy, there are quite a few hurdles. I call them caps and gaps that they have to meet. So, they have caps that they're going to hit and what they're going to be able to utilize from the policy, but then they have gaps, which is not covering short-term assistance, which is really how we offset longer-term care needs. And they also have the deficiencies. So waiting till someone becomes very debilitatingly sick. And so we took that and said, well, where do we have the room for improvement? And so by partnering folks who join our program with a wellness coordinator who is a registered nurse or a licensed practical nurse, we step in sooner. And so for them to utilize the benefits of the long-term care policy that we're offering, we're covering short and long-term care. So if they have a planned surgery or they've developed a cold, we want to be able to step in that much sooner and provide services to really prevent that from becoming something more serious.
That's fantastic. I mean, especially the medical procedures, as you get older, they're very taxing on the body. You can start thinking about prepping up before you go into it. And
even routine things, I'm sorry to cut you off, but even routine things like a cataract surgery. We've got folks that say, I'm close with my neighbors, but I don't know who I'm going to call that's going to go and sit there and wait for my procedure just to bring me home. So it's even shorter term things like that where they know and they've met and they have a relationship with the person that's going to be there. And all it is a phone call. There's no claims to file. There's no forms to fill out. There's no physicians to go through. It's strictly just a conversation. It's one phone call, 24 hours, 7 days a week with access to an RN.
So what's the top, when families are calling in off of this and we talk a lot on our show about activities of daily living, right? So you're monitoring that, you see the ADL starting to slip in one particular place, you want to get engaged off of that, and they're trying to figure out how to activate where that bridge. They want to build that plan for you. What should a family be prepared to talk with you guys about? What should they?
Really, when we're working with adult children, because we want to empower the folks that are joining us. So the actual older adults that are joining our program and empower those decisions. And so when we're working with their adult children, it's making sure that we're aligning the goals are with what mom and dad or mom or a dad really wants. And so I know as an adult child, what I want is to make sure I have peace of mind that mom and dad are going to get quality care, reliable care, and that they're not going to be taken advantage of.
Right.
And so when we have folks coming to us, really educating them on who is going to partner with mom and dad and how it's going to work and how they're going to avail of it, but also how the adult children can still stay involved and feel valuable. Because just because we're stepping in, we may be a pseudo daughter at times, but we're still going to be the conduits that say, if mom or dad lands in the hospital, we're going to give you a phone call with not just what happened, but the plan of action moving forward.
And that's big, because you could try to cast this away or put this out of your mind up front, but it's just not realistic. We have emotion that we're dealing with, and we need to be able to process that emotion as we're going through. It sounds like, Sun Health really can take some of that off and help step into that role with clearly you're going to have an attachment because you're going to build a rapport with our parents, which is an important thing.
And we want to build that relationship with their children as well. So we encourage, when our members are joining and their kids are visiting or coming to town, we encourage their kids to come to our social events. If we're going to Barrett-Jackson, come with us. If you're going to be in town, let's go out to dinner and get to know the nurses that you're working with, so that you have that confidence in us, just like your parents will.
Right. That's important. It helps people understand what their role would be and how you can lean on them. That's fantastic.
And having a face to the name, nothing is more important than that. Nothing is more important to building trust than having a face to put to the name.
That's super, super important, especially too if you live out of state or you live away, and it really weighs on your mind as mom and dad are getting older.
It does.
So where do people learn more about you guys?
So the biggest way is I do host ongoing seminars, but if they want to be able to reach out to us, they can reach out to our website, which is sunhealthathome.org. We are a nonprofit, but they can reach out to us on Instagram, on Twitter, on YouTube, and on Facebook. It's Sun Health. On Instagram, Twitter, or even LinkedIn, it's going to be Sun Health AZ.
Okay, great. And for those that might live in other regions of the country, are you guys primarily, you're in Arizona, Phoenix type area? Is there for Sun Health, do we find you around the country and other places, or
we're going to be
looking for you here?
Yeah, we're going to be based out of Phoenix only. So we do have a 50-year nonprofit legacy in the Valley. We actually built Boswell Memorial Hospital and Del Webb Memorial Hospital that are now Banner hospitals. But if anybody does live around the country, we do have partnerships with all the other programs. So if someone lives in Virginia or Florida or Ohio, and they've got folks, they are parents or aunts and uncles they want to be able to provide information for, I'd be happy to connect them with the other programs around the country.
That's fantastic. I really appreciate it. Thanks so much for coming in and sharing more about your company. And
thanks for having me.
Yeah, it was blessed having you up here. And we're going to come back to you here a little later at the 2023 Scottsdale All Things Senior Expo here in Scottsdale, Arizona. Stay tuned.